What is cardiac reserve? A. The volume of blood in the ventricles at the end of diastole. B. The difference between the heart's maximum output and its output at rest. C. The amount of blood pumped by the heart per minute. D. The volume of blood returning to the heart during diastole. Answer: B. The difference between the heart's maximum output and its output at rest. Which factor does not influence cardiac reserve? A. Heart rate. B. Stroke volume. C. Blood viscosity. D. Myocardial contractility. Answer: C. Blood viscosity. Which of the following conditions is most likely to decrease cardiac reserve? A. Hypertension. B. Myocardial infarction. C. Mild exercise. D. High altitude. Answer: B. Myocardial infarction. How does regular aerobic exercise impact cardiac reserve? A. It decreases cardiac reserve. B. It has no effect on cardiac reserve. C. It increases cardiac reserve. D. It only affects cardiac reserve in elderly individuals. Answer: C. It increases cardiac reserve. Which of the following is a direct method to measure cardiac reserve? A. Echocardiography at rest and during exercise. B. Measuring resting heart rate. C. Blood pressure measurement. D. Electrocardiogram, ECG, at rest. Answer: A. Echocardiography at rest and during exercise. A 60-year-old patient with congestive heart failure is likely to have A. Increased cardiac reserve. B. Normal cardiac reserve. C. Decreased cardiac reserve. D. No change in cardiac reserve. Answer: C. Decreased cardiac reserve. Which of the following mechanisms is primarily responsible for increasing cardiac output during exercise? A. Decreased heart rate. B. Increased peripheral resistance. C. Increased stroke volume and heart rate. D. Decreased blood volume. Answer: C. Increased stroke volume and heart rate. What is the primary physiological limitation to cardiac reserve in elderly individuals? A. Increased cardiac muscle mass. B. Decreased myocardial contractility. C. Increased number of cardiac myocytes. D. Decreased blood pressure. Answer: B. Decreased myocardial contractility. Which of the following conditions can lead to a hyperdynamic cardiac state, thereby temporarily increasing cardiac reserve? A. Severe anemia. B. Chronic obstructive pulmonary disease, COPD. C. Hypothyroidism. D. Chronic kidney disease. Answer: A. Severe anemia. During which phase of the cardiac cycle is cardiac reserve most effectively assessed? A. Systole at rest. B. Diastole at rest. C. Systole during stress. D. Diastole during stress. Answer: C. Systole during stress.